One of the reasons that taking that first step to see a fertility specialist, if you think that you may have infertility, it can be very daunting because it feels like there are zillions of tests out there. The truth is, the fertility workup is actually quite simple. So I want to walk you through what I consider the standard fertility workup. And obviously, every case is individualized and there could be other tests that need to be done depending on your situation. But the main things you're really looking at are the 4 components of what it takes to get pregnant. The ovaries and the eggs they contain, the sperm, and the reproductive tract, which consists of the uterus and the tubes. So for the ovaries, the only thing I can really tell you in an individualized way is your AMH and your egg count on the ultrasound that both tell us at this snapshot in time how many eggs you have. And the only reason I care about this is to understand if you're a good candidate for IVF. Do we have a lot of eggs to access if we need to go down that path? I also test other hormones coming from the ovary like estrogen and progesterone, and some of the pituitary hormones from a gland in your brain like luteinizing hormone or follicle stimulating hormone. I will also check another pituitary hormone called TSH or thyroid stimulating hormone. Thyroid is important for so many different aspects of your health and your reproductive health, mostly because you want to make sure you have enough thyroid function to support fetal development. If you have irregular cycles, then there may be other specialized tests in terms of blood work that we would do, but that's beyond the scope of this video. Next, let's talk about the sperm. So the way we look for male infertility or sperm quality issues is we get a semen analysis. And this is basically where the male partner will provide a sample of sperm and we look at it under the microscope and we assess things like the concentration of the sperm, the percent of the sperm that's swimming in a forward direction, and the percent of the sperm that's shaped normally. That's called the morphology. And we also look at the volume of the sample. If the first one comes back abnormal, we'll often retest because men are always making new sperm every 3 months, and so quality can fluctuate. But if it's persistent, we'll usually have you see a urologist for further workup. Next, let's talk about the reproductive tract. So as I mentioned, I normally do a transvaginal ultrasound to get a really clear view of the ovaries, but I will also look at the uterus. And if I can see anything obvious, like fibroids or polyps, anything that's a red flag, I treat it like the MTA. If I see something, I say something, and I'll tell you right then and there. But don't be fooled by a seemingly normal ultrasound because your uterus is a collapsed cavity. And so often you have to put some fluid or something in there to push the walls apart to really get a clear view and make sure you don't have fibroids or something structural going on with the inner cavity, taking up valuable real estate from where an embryo might want to implant. There are a couple of ways that we can assess the uterine cavity. One way is called an HSG or a hysterosalpingogram. Now, this is a 2-for-1 test. What it entails is putting dye through the cervix. So you're on a table, you have a speculum exam, the dye is pushed through the cervix into the uterus, it fills the uterine cavity, which looks like a triangle, and then can spill into the fallopian tubes and out the ends. And then you have an X-ray done, which causes that dye to light up on the X-ray, and it shows you whether there are blockages in the fallopian tubes, and if there are any structures jutting into the cavity. Basically, it's giving you like a silhouette of the reproductive tract. But you could also say, this patient is going straight to IVF for whatever reason. I don't really need to look at the tubes per se. So you could just as well do something called a saline sonogram where you use fluid, saline, in the uterine cavity. You're not trying to get it through the tubes or visualize the tubes. And on an ultrasound, which can be done in the clinic setting here, we're basically looking at the inner cavity of the uterus and identifying if there's any issues. So that's it. That's the basic infertility workup. If you're going through this process for the first time and there are other tests outside of this realm and you're feeling overwhelmed, just ask your doctor, why are you recommending these other tests? And are they evidence-based? Are they necessary? What are we actually looking for? Stay tuned for my next video on what to do if all these tests come back normal.